Ontario's vaccine rollout remains our best defense against COVID-19 and our best path to getting ahead of this terrible virus. For months, thousands of dedicated people have been working around the clock to get vaccines into arms and have done an incredible job. We have the infrastructure and we have an incredible team in place. And as of today, we're ahead of the schedule we set, with over 65% of adults in Ontario having received at least their first shot. We have now administered over 8.5 million doses. You think of that? Those are staggering figures. In fact, earlier today, our officials revealed that when compared against Israel, the UK, and the US, the speed of Ontario's rollout, once we got steady supply, is being amongst the best in the entire world. That's thanks to each of you signing up to get your vaccines. And it's thanks to thousands of people working at the vaccine clinics. Because of your efforts, we're now in a position to accelerate second doses in Ontario. This is great news, and I know many of you have been waiting for. As we manage supply, we're beginning with our most vulnerable, the people who need the most protection first. Starting on Monday, second doses will be offered to anyone over 80 years, followed by anyone over 70 years old, beginning the week of June the 14th. Once we've provided more protection to our most vulnerable, we'll begin offering Ontarians their second doses on a first-come, first-in, first-out basis. That means we'll expand second doses based on the date you received your first. As we do, we're reducing the time between your first and second dose, down from the current 16 weeks to as soon as 4 weeks after your first shot. Of course, this depends on the vaccine supply and the availability of appointments in your region. So while not everyone will be able to get their second dose shot 4 weeks after their first, we want to ensure you're fully immunized as soon as possible. This is extremely important news. It means more protection from this horrible virus sooner. It means we can begin getting back to doing the things we love. And it means we're all getting one step closer to returning to normal. Because the faster we deliver vaccines, the faster we can put this pandemic behind us for good. We see what's happening in other places where people have been fully vaccinated. Well, the good news is that can be us. Based on what we know about upcoming shipments, everyone in Ontario who wants a vaccine could be fully vaccinated by the end of August. That's right, friends, Ontario is ready to deliver a 2-dose summer. But I want to make sure to go faster, and we're going to do everything we can to go faster, and we will make sure we get the needles into people's arms as soon as possible. We can further accelerate second doses in Ontario. All we need is more supply. Everything is in place, and we're ready to go. All we need are the vaccines, because we're in a race against the new, more dangerous variants. While one dose provides some protection against these variants, it doesn't provide nearly as much as 2 shots. So as we speed up our rollout, we need the federal government to heed our call. We need them to fix the problems at the borders. Yesterday, an expert panel weighed in on our borders. They made one thing clear: the measures in place at Canada's borders have failed Canadians. The rules are inconsistent. They're full of loopholes. The federal government has been put on notice by its own experts. And last night, I raised this issue once again directly with the Prime Minister. I've been demanding a federal strategy to protect our borders for months now. So far, we've seen zero response from the Prime Minister, and it's unacceptable. And just like during the third wave, we in Ontario could end up paying the price for their inaction on the borders. Now, before we take questions, I want to address an issue that I know is on the top of parents' minds, and it's on the top of my mind as well. No one wants kids back in school more than I do, but We have to ensure that any decision is based on sound scientific and medical advice that protects students and staff in schools. Ontario is not an island. The introduction of new, more dangerous variants into our communities through Canada's borders poses real risks to our schools. That's why this week I wrote to the experts in health, public health, and education asking for their input. I've always said Ontario has the best minds in the world. Together, we make the best decisions. So I look forward to hearing back from our experts and using their input to make the decision that best protects our students and school staff. Nothing matters more. Thank you, and God bless the people of Ontario.
We'll go to the phone line for questions. First question, please.
From Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Rob.
Hi, Premier. On the schools, yesterday Dr. Williams was saying that most of the health units are ready to roll on schools. He's ready to roll on schools. You always say that you listen to Dr. Williams. So with what you were saying just now, are you afraid to make a decision of your own on reopening schools?
No, I've never been afraid to make decisions. Matter of fact, I've made some of the toughest decisions and probably not popular decisions, but we're there to protect the health of the people of Ontario. And our decisions, as you've seen with the advice of the health experts, have brought the cases down lower. All I want, Rob, is I know very clearly where Dr. Williams stands, but I want the scientists to weigh in. I want to make sure that the teachers' unions weigh in. I want other educational workers to weigh in. I just, I don't want to rush this. If it takes a couple extra days, so be it. This is a massive decision. This is a decision that's going to affect every single person in Ontario. We know that 25% of families have at least one child in everywhere from kindergarten to grade 12. But that 25%, they're going to affect the other 75%. So we want to be very, very cautious. The science table has said that we open the schools, these numbers are going up. And I'm really concerned about the variants. We weren't dealing with the deadly Indian variant a few months ago. We're dealing with it now. And I'm concerned that as the expert panel, the federal expert panel came back and said, there is basically no plan for the federal borders. And that's unacceptable, in my opinion. People are coming in. We saw the Indian variant, Rob, go up in the last 2 weeks, 600%. Those are staggering numbers. And I mentioned this to the Prime Minister. It was like, as far as he was concerned, there didn't seem like there was a problem. It was like one of those things, okay, folks, nothing's happening here, just keep moving on. Pretend the borders aren't happening. I'm sorry. This could cause a fourth wave if we don't tighten up the borders. It's absolutely critical.
Follow-up?
Understood. Thanks, Premier. What do you say to the critics, though, who are saying that you're doing this because you put out this appeal for this consensus because you're looking for someone else to blame if reopening of schools goes south?
Rob, let me tell you right from the get-go, I've come up here and I haven't heard too many other elected officials say this. At the end of the day, buck stops with me. I'm responsible for the good things. I give all the credit to the frontline healthcare workers. If things go a little sideways, I'll take responsibility, which I have. And if they don't go the right way, I'll get up and apologize and correct it immediately. In saying that, we want the experts. This is a big decision, folks. We're talking for the next few weeks, kids are going to go in school, and I want to make sure the kids are safe. I want to make sure that the teachers are safe because we have some great teachers in this province. And then it gets into the community. And this Indian variant that came in through our borders, it's going to cause an issue. When I have the science table, Dr. Brown told me directly, Doug, this could be 6 to 11% increase. That could equal to thousands of cases. Folks, do you want to go backwards again? I don't. I want to look forward. I want to make sure, looking forward, that we're able to get the kids in camp. I want to look forward to make sure we have a great September for the kids to go back into school. And this could affect our opening as well. So I want to make sure all the T's are crossed, I's are dotted, and I'm going to be super cautious. And over a couple extra days, folks, it's well worth it, getting a consensus from everyone.
Next question.
From Lorenda Redicop at CBC News. Please go ahead.
Hi, Lorenda.
Hi there, Premier. From the technical briefing, it sounds like there's no plan to assist seniors to ensure that they can have a sped up second dose. We've heard from experts that this is crucial to protecting those people who are most at risk, but they'll have to be going through the online system or the phone again. Why doesn't your government have a plan to help them?
Well, we have a very strong plan in place, and that's how we were able to really hammer out these vaccines. I've always said right from the get-go, give us the vaccines, and we'll get them into people's arms. The people on the front lines, the healthcare workers that are putting needles into people's arms, the paramedics, the firefighters, and mobile units, this is nothing less than spectacular what they've done. I've never seen a more well-oiled machine in every single person I've talked to. No matter if they're seniors or not seniors, they said it was seamless, they were friendly, they went in, they got the needle, they went out, and everyone gets all the credit. I don't need the credit. They're the champions, but I'm going to pass this over to the Minister of Health and on that. Thank you.
Well, thank you. We are accelerating the doses for people 80 plus starting next week, making sure that they have the opportunity, if they wish, to book their second appointment sooner than what they already have, the date that they already have. If they choose not to do so, they don't need to do so. But there are very many ways that they can obtain a second shot appointment through pharmacies, through primary care practitioners, through the online booking tool, through the phone lines. We didn't have a problem with people 80 plus getting their first doses organized, and we're sure that their second doses won't be a problem either.
Follow-up?
There are tens of thousands of AstraZeneca doses we know will be expiring on Monday. Could you give us a number of how many you expect will end up being wasted? And we have been hearing concerns from pharmacists that they didn't know what was going to happen. So if there are doses that will be wasted, how much will be because of bad communication?
So the second doses of AstraZeneca that at this point are set to expire on May 31st, we wanted to offer those to people who wished to have a shortened time period of the 10 weeks, which is why we were very specific about saying if you had your first dose of AstraZeneca between May 10th and May 19th, you have an opportunity, if you would like, to receive that AstraZeneca sooner, that second dose sooner. It is a very limited supply, but because the AstraZeneca had been distributed throughout Ontario at this point, when Health Canada put a pause on using AstraZeneca for first doses, we had to return that AstraZeneca to the 3 zones in Ontario, the 3 communities, Kingston, Toronto, and Windsor-Essex, that had offered the original first dose. So it was a matter of moving them back into those 3 communities, making sure that they still had the cold storage chain, that they were safe. We've done that, and that work is ongoing. And as soon as we get the approval that they continue to be of the highest quality, we make sure that pharmacies in Toronto, Kingston, and Windsor, Essex are getting it. I know people are excited. I know that a lot of people want that second dose sooner, but it is a very limited supply that we are offering up to make sure that we use all available doses. Thank you.
Yeah, just to add, in Solicitor General, it's March the 10th to the 19th. I think you accidentally said May the 10th. So anyways, just want to reinforce that, March the 10th to March the 19th. If you ended up getting an AstraZeneca shot, then you're eligible. And again, that's Kingston, Windsor, and Toronto, because that's the time frame, the 10 to 12 week time frame. And as we get more, we're going to start rolling it out based on the dates that the doctors prescribe.
Next question.
From Richard Southern at 680 News. Please go ahead.
Hi, Richard.
Hey, Premier, how are you?
I'm doing good. How are you?
Good, thanks.
Good.
I've talked to some restaurant owners who are ready, staffing-wise, to open their patios in the next couple of days. The vaccination rates are where you wanted them to be for step 1. So, Premier, are you prepared to relax some of these restrictions like patios, and let them open before June 14th?
Well, we're going to work closely on the guidelines, and that was June the 14th, and hit those targets. It's not just there's more than just the 65% and the second doses. We have to look at the ICU capacity, and thank goodness we see it coming down. We have to look at the positivity rate. So there's a lot of other factors involved. I got to tell the business owners, I've said this before, mortalities weighs on you more than anything, anyone, anywhere. Secondly, are these businesses. It kills me to keep these businesses closed. But I have to, for the long term, protect everyone's health. For the short-term pain that we're going to face over the next maybe a couple of weeks, there's light at the end of the tunnel, and everyone in Ontario knows we're going to be opening up, but we're going to open up cautiously and carefully, very cautiously and very carefully, because I do not want to happen what happened before, and all of a sudden the cases go up, and all the elected officials that are out there right now that are listening to this. I remember back in March, you were all saying, open up, open up, open up. And you know something, as soon as those numbers went up, everyone just dove for cover. And so we're going to make sure we're going to be cautious.
Follow-up?
Premier, since we're talking about second doses here today, there's always going to be a group of people who don't want to get the vaccine. There's been talk in other jurisdictions about offering them incentives, lottery and what have you. Are you in favor of that in Ontario? And also, any more thought given to what's, a so-called vaccine passport, a proof of vaccination that would be required to do certain things in the province, Premier?
Well, first of all, the vaccine passport, that's going to be a federal issue. They had that discussion last night with the premiers, and it's an open discussion on that for the federal government. And so that's what we're going to wait for the federal government to come out on that as well.
Next question.
From Camille Camerali at Global News. Please go ahead.
Sorry about the last reporter. I think I didn't answer his first question. I
Question.
apologize.
There's already been a lot of criticism after the tech briefing related to this rollout and just the confusing chart of it. And a lot of people are drawing it back to the first dose rollout. So I guess the question remains, didn't the province learn its lesson the first time? It's tough to read. It's tough to understand for a lot of people. How is the general public expected to understand this?
Wow, we're going to fully and respectfully disagree. Talk about the rollout. This has been nothing but spectacular, getting 8.5 million people vaccinated, getting numbers up to 180,000 to 190,000 a day. I don't think you comprehend the logistics of filling 180,000 syringes, the size of Ontario, the 15 million people. We're pumping it out. As the chart showed, and we'll send you over the chart, we're ranking in the best in the world on this. As the Minister of Health just mentioned, you have your phone line, you can go online, you can walk into a pharmacy, you can go to your primary care, and some hospitals are giving it out. Like 8.5 million people figured out how to get it, and we're going to make it just as easy as long as we get supply. I'm going to give you a quick two-second story here. I talked to someone in one of the big automotive manufacturers. I said, imagine doing this, and he said, I can't figure out how you manage the logistics. Just imagine trying to build a car, and I'll use Moderna, for example. We don't know when the next Moderna shipment's coming in. We don't know when the next AstraZeneca shipment's coming in. And we're trying to deal with 3 variants and getting people vaccinated all in different locations. That's how sophisticated this gets. But I'm going to pass this over to the Solicitor General.
So the Premier's talked about the challenges of dealing with currently 3 different vaccines that have been approved by Health Canada, different pathways in which people can receive those vaccines. And, respectfully, we've hit 65% of Ontario residents over the age of 18 sooner than our goal, which was the end of the month. We have some amazing successes that people should be very proud of. But it all comes down to a lot of partners working together, public health units, primary care practitioners, pharmacies, distribution centers, Operation Remote Immunity, where we tapped into our orange capacity. It is amazing to see hospitals and all of these individual organizations working together, because they understand the ultimate goal is to offer the vaccine to you as soon as it is available in your area. And we will continue to do that. And you know, it has been a very positive May in terms of seeing consistent supply of Pfizer, but Moderna, as Premier Ford mentioned, has been very inconsistent in when we receive it and how much we receive. As those supply lines become more consistent, it just makes it easier to offer it to more people. Thank you.
Yeah, not to mention, people don't realize we have vaccinated second doses over 600,000 people already. Like, these are staggering numbers. And I give all the credit to the frontline healthcare workers. These folks are champions. So I think they're doing a heck of a job.
Follow-up?
Thank you for that. And I guess the other question I have is related to pop-up clinics and hotspots. A majority of people were able to book on the Ontario portal via the mass vaccination clinics. But when it comes to the pop-up clinics, including for myself and thousands of other people who got that first dose at a pop-up clinic, they were told, don't call us, we'll call you. And that just leaves a lot of confusion because, people like myself are refreshing their inboxes without any clarity when that second dose will happen or when we'll hear back. So what clarity can you give people who went to those pop-up clinics? Yeah,
well, first of all, that's a great question. I ended up getting a phone call from the drugstore the other day and said, okay, you're up. You got it on the March 19th. And I said, I'm holding off until other people can get theirs first. But I'm going to hand this over to the Minister of Health and maybe the Solicitor General.
Well, regardless of where you received your first dose, if it had been at a pop-up clinic, wherever it is, you're in the COVAX system. And so it has been recorded. Your date of your first dose has been recorded. When it is time for your second dose, as the Premier indicated, you will be contacted. However, if you know the date of it, you now have the option, depending on which type of vaccine you received, to book in for your second dose, and you can do that by doing it through the online center or calling them to set up your second dose. So it is possible to do that yourself. You will be contacted during the regular time, but if you wish to do it within the shortened time period, if you're eligible for that, then you can certainly go ahead and arrange that.
Okay, we're going to pass it over to the Solicitor General as well.
The only thing I would add is that, part of our goal with offering multiple pathways for getting your vaccine was choice, convenience. And so as we have continued to expand the pharmacy model, by the end of the month, we're going to have upwards of 2,400 pharmacies across Ontario. And again, when they have sufficient inventory, individuals who perhaps got their first dose at a pop-up clinic near their place of work might opt to go to their neighborhood pharmacy. And that is perfectly fine because, as Minister Elliott pointed out, you are registered in COVAX. So we know exactly the type of vaccine that you received, when you received it, and when you qualify for the clinical advice on when your second dose happens, you will be able to choose the most convenient model for to be flexible and convenient for you. Thank you.
Last question.
From Christina Roland at City TV. Please go ahead.
Hey, Christina.
Good morning, Premier. Hi. I just want to go back to Lorendo's question, and I guess the question for the Solicitor General. How many doses, or will any doses of AstraZeneca expire on May 31st?
It's not a clear-cut answer, and the reason I say that is as the AstraZeneca was pulled back in to be distributed in Kingston, Toronto, and Windsor-Essex, Before they were redistributed, they are being checked to ensure their quality. We want to make sure that that second dose is of the highest quality. We're taking the time to do that, and as lots are approved, and thousands have already happened, then they get distributed to the pharmacies in Toronto, Kingston, and Windsor. But I can't give you a hard answer on how many we expect will not be able to go through that quality assurance piece. But I think it's really important that we understand how critically important that is. We want to make sure that the doses we are offering for second doses are checked first for quality assurance, and we're doing that now.
Follow-up?
And then just going back to the Moderna, what do you say to all of those residents who have received the Moderna because there still isn't any clarity coming from NACI as to what to do next? So what do you want to say to them with only 21,000 doses coming?
Yeah, that's exactly, and great question, Christina, because that's exactly what I was mentioning on the line yesterday. There's inconsistency on supply. How do you build a product when you don't know when you're getting the parts in? And right now, we have no line of sight whatsoever when the Moderna, someone said, when's Moderna coming in? Isn't it a shame that no premier in this country can tell you when it's coming in? That's a game changer, because if we get this Moderna in, man, that's gonna really accelerate the doses. It's gonna bring down the gap of waiting for your second dose. So right now, we know what we're getting in Pfizer. We don't know when the next shipment of AstraZeneca is coming in, which always makes it challenging. It makes it very difficult when we don't know when Moderna is coming in. You know, I just want clarity from the federal government. That's all we're asking for, and it makes life so much easier. Folks, when you saw that we were getting supplies of Moderna, Pfizer, and AstraZeneca, Team Ontario just pumped these vaccines out like I've never seen before. So give us the ammunition, and we'll make sure we get the needles into people's arms. I'm just going to wrap this up. Folks, we're going in the right direction, and all thanks to each and every one of you following the guidelines. I know the guidelines were tough, but there's proof in the pudding here. The numbers are coming down. We're going to get back to normal. We're going to make sure that we have a great July, a great August. We're going to make sure every decision is based on moving forward on a cautious decision. We want the kids in camp on the beginning of July, and we want people to get back to normal. So just hang in there. Everyone's doing great. Frontline healthcare workers, your champions, and the people of Ontario have done an incredible job. So thank you, and God bless you. Have a great, safe weekend. Thank you.
Thanks, everyone.